Hi, I'm Christine. I am at the Visalia Navigation Center for my internship. It is a low barrier homeless shelter that was built in November of 2024. So it hasn't even been opened a year yet. It's a fairly new shelter. It's the first of its kind in Visalia. Low barrier meaning that the participants who stay there don't have to test negative for drug use. They just can't bring any substances into the shelter. It was built in response to the homelessness or housing crisis in California, and specifically in the Central Valley, to try to provide more housing for these people that don't have homes. I wanted to try to answer the question of what I can do at my internship site to address issues of social, economic, or environmental injustice and advance social and economic justice. One simple thing I found I can do that I've been currently doing at my site is speaking individually with the clients, getting to know each of the participants, their stories, trying to find out how the client came to be there. There's a quote in one of our books, A Practicum Guide for Social Workers, by Shalag Larkin on chapter 8, it's page 178. It says, this is talking about the ADEI and specifically about ethnicity. It says a client's ethnic reality will affect many facets of their life, which may be related to the problem the client is seeking assistance for, such as parenting, homelessness, and addiction. Similarly, it is important to consider how the client became a client and reflect on the fact that clients come to the attention of agency services and social workers in many ways along a continuum of voluntary to mandated. And regardless of the route, it is important for the social worker to elicit the client's understanding of the problem. So that's one thing I'm trying to do, is just understand their problem, understand how they came to be at the shelter, what brought them there. Also, I believe that the shelter itself, just the fact that I'm at a homeless shelter, the shelter is trying to address some of these issues of economic injustice and social injustice by providing beds, places for these people to sleep, personal hygiene items, even clothing sometimes, places for them to shower, to wash their clothes. They even have dog kennels there and computers they can use to job search. They even planted a garden in the back just recently, or some volunteers came and planted a garden that they can grow their food from. They get 3 meals a day there. So trying to make sure that their basic needs are met so they can focus on some of these other important things. I did ask a supervisor at the homeless shelter, about some of the clients, someone that has been there since the beginning, the start of the shelter. And she remarked that she thought probably about 80% of the participants grew up in foster care system, somehow were in the foster care system at one point in their life. And so it would be interesting just to research that and what factors have gone into, what factors contribute to homelessness, to how they get there. There's also, I noticed a high percentage of participants there that use substances. Of course, this creates its own problems or difficulties in the shelter. Not all of the participants are really willing or ready or want to change, but I've seen that as helping them at the shelter, we just need to meet them where they're at and what they're willing to do, and try to help them find some stable housing. But it does make me want to study the bigger picture. It also reminded me of a quote I read in our e-textbook, Addiction Treatment, A Strengths Perspective, that is by Van Wormer and Kay Van Wormer and Davis. And this is on page 519. And this Nora Volkow was the director of the National Institute on Drug Abuse, NIDA. She visited a methadone clinic and she was talking to the patients, and she described the inability of the methadone patients to even make appointments because they didn't have housing or food or shelter, and they were just trying to figure out how to obtain, get the necessities of life. And she said, talking to these patients demonstrated to me that treatment isn't just about the delivery of a medication or some other intervention that works in ideal laboratory conditions. It is also about the social and economic factors that shape people's real lives day to day. Across many institutes of the NIH, research is increasingly focusing on social determinants of health. Factors like work and housing instability, food insecurity, racism, class discrimination, immigration status, and stigma, and their integral role in shaping risks and treatment outcomes for many health conditions, and specifically for substance use, it was talking about in the book. And so I think trying to address and help with just some of their basic needs to have a home, to have food, to be able to find a way to clean their bodies is a way that this homeless shelter is addressing on a bigger scale the social, or at least in our Central Valley, the social, economic, or environmental justice. I also thought of something on a meso level that I could do. I noticed they do have some donations of clothes there at the shelter, and we are lacking many men's clothing, men's shoes, things like that. I thought of my church congregation and maybe even other churches in the community or different groups in the community that might be willing to donate, that I could try to connect some of their services with our shelter to get some donations for clothes, just some basic things like that. But those are ways that I'm trying to address some of these issues at my shelter, and it's been really eye-opening and a great learning experience to be there. Thank you for listening.